So this is the part 4 of ophthalmology where we're talking about eyelid diseases. So now I want to talk about blepharitis. So blepharitis is a chronic inflammation of the eyelid margins, and what's important here is that it is in fact chronic, which really distinguishes it from our previous talks on hordeolum. Remember, chalazion and hordeolum with the other eyelid diseases we already discussed. And of those, hordeolums were actually acute suppurative, okay? Whereas our chalazions were also chronic. So blepharitis is chronic inflammation. And essentially, it can be due to two different causes, and those two causes include meibomian gland dysfunction. This is popping up again and again, so I do suggest if you don't know the eyelid anatomy and you don't know what the functions of these meibomian glands are, you check out the video before the last one and it will explain it very well. So there can be two types. It can be due to meibomian gland dysfunction or seborrheic dermatitis. And the interesting thing is, because meibomian glands are actually more likely to cause posterior blepharitis, whereas the seborrheic type is more likely to cause anterior blepharitis. So anterior would be on this lid over here and posterior would kind of be on the inside. So this here is an example actually of posterior blepharitis, where you have to kind of really retract the eyelid margin and see inside, and there you would see the blepharitis. Now, the important thing is, the thing you have to remember whenever you think of blepharitis, your high yield, high value point is that it's always typically associated with crusting and flakes. So essentially you have this red, itchy and irritated eye. So I want you to remember this picture actually, because here you can quite clearly see here there's matting of the eyelashes. There is matting of the eyelashes because they are typically wet. They're wet when they wake up, okay? So when the patient wakes up in the morning, there's matting of the eyelashes. There's a red, itchy and irritated eye. So you have those symptoms that we already have of inflammatory eyelid diseases. But now you also have this dryness and flaky stuff. You have this crusts and flakes around the eyes. Here, if you look in this image, there's crusting at the base of the eyelashes. And that is highly characteristic and pathognomonic for blepharitis, okay? And here you would see the crusting and flakes. So always remember, blepharitis is badly crusty or badly flaky or badly dry. Blepharitis is badly dry. Now, blepharitis is also more common in patients with acne rosacea. The meibomian glands are secreting your oil onto this eye surface, and this will prevent the rapid evaporation of any tear film. So the thing is, with the meibomian glands, they're secreting this oil layer onto the eye surface. But what does that oil layer do? It prevents this rapid, quick evaporation of this tear layer. And if remember, the meibomian glands are typically supposed to release the oil and supposed to prevent this quick evaporation with this lipid oil layer. But when you don't have the meibomian glands, then you don't have that protection from that quick evaporation of the layer. And therefore, when you do have that quick evaporation, that will lead to drying of the eyes, which leads to the irritation. So I want to discuss the clinical features, and the clinical features are typically bilateral. There's discomfort and irritation, especially around the eyelid margins. The eyes may be sticky in the morning, and there will potentially be matting as well of tears. The eyelid margins may be red and swollen. Eyelids may be swollen specifically in the staphylococcal blepharitis that we have. And remember, styes and chalazions may arise more commonly in patients with blepharitis. Now, these images are actually for our posterior blepharitis, so don't consider them right now, okay? Anterior blepharitis, I like to think of it as the two S's of anterior blepharitis, which are seborrheic and staphylococcal. So there's two types of anterior blepharitis, and those include seborrheic and staphylococcal. However, the presentations are similar. There's something specific about the staphylococcal type, which is to do with ulcers and ulcerative type. But I'll come into that next. Just remember, there's two S's of anterior blepharitis, and those S's are seborrheic as well as staphylococcal. So the seborrheic, it's chronic inflammation of the anterior lid lamina. It involves the glands of Zeiss and Moll. So remember, we talked about the glands of Zeiss and Moll. They were the other glands that are present there to secrete sebum and those kinds of things. Now, the seborrheic one is associated with seborrheic dermatitis or dandruff. So remember, this one is also known as squamous. And squamous is skin, and whenever you have skin flakes coming off, that's known as dandruff, or dermatitis is one step ahead of that. Now, the treatment here would be lid hygiene. I'm just saying those are ways you can remember this, okay? The treatment would be lid hygiene and local antibiotic steroid. So lid hygiene is very important. What do we mean by that? We mean baby shampoo with regular washing of the eyelids and the eyes. The important things here were that now we're talking about Zeiss and Moll glands. We're no longer talking about our meibomian glands, all right? Now we're talking about anterior blepharitis. Remember, anterior blepharitis is always actually associated with dysfunction of Zeiss and Moll. And posterior blepharitis is essentially the same thing as meibomian gland dysfunction. Why is that true? Well, because of the arrangement of the meibomian glands, they're kind of, you look, these are the meibomians. They're kind of coming in, and then you would have to retract the lid that way, so it would be the posterior aspect of the lid. Whereas Zeiss and Moll will always be involved in anterior blepharitis. Now, the important thing, seborrheic is associated with dermatitis, skin conditions, dandruff, all of that stuff. Staphylococcal is in fact in what is it? Chronic inflammation of the anterior lid lamina. It involves the glands of Zeiss and Moll. It's caused by Staph aureus. Now, interestingly, the symptoms here are scaling and crusting of the lid lamina, of the lid margin. There's the scaling and crusting. Remember, I showed you this picture? Here, there's scaling and crusting in this region, especially in the staphylococcal one. The crusts on removal may leave small bleeding ulcers. So that's what I was talking about. With the staphylococcal one, you can also call it the ulcerative type, because typically these bacterial caused staphylococcal induced blepharitis episodes are ulcerative in nature, and that just means that they're on the lid, on the eyelid. We would expect to see crusting and dry flakes, and then if the doctor tries to remove it, if any of the crusts are tried to remove, there will be bleeding. There will be bleeding. Let me just quickly check if I have the diagram of this here. With the ulcerative blepharitis, here you can see the matted eyelashes which are joining together, and then you can also see this yellow crusting, okay? This yellow crusting things, and those are signs of ulcerative type of blepharitis where there's crusts and there's bleeding. Look, I'm trying to draw these blood coming out. There's bleeding, okay? There's bleeding as well. Now, what's important is that blepharitis can be severe enough to complicate very rapidly, and these complications can be dangerous. So you can have different complications such as the loss of your eyelashes, that's known as madarosis. You can also have whitening of your eyelashes, which is known as poliosis. You can have inward turning, which is known as trichiasis. You can have ptosis, drooping of the eyelid. You can have conjunctivitis. You can have keratitis when it actually starts to affect the cornea. You can also get, now the treatment in this case would still be eyelid hygiene again, as well as topical steroid, because you're always trying to reduce that inflammation. You're always trying to work to reduce that inflammation. Now, what was important for the seborrheic blepharitis? It arises commonly with which other conditions? With dandruff and also with seborrhea. And it's chronic. Both of these are chronic. All of these blepharitis episodes are chronic. Now, what was important for the nature of the crusting in the Staphylococcal blepharitis? What was important was that in the Staphylococcal blepharitis, upon removal, the crusts may bleed. Okay, the crust may bleed. There may be small bleeding ulcers. Before that, you would have scaling and crusting of the margins. The Staphylococcal one can have severe complications like poliosis, whitening of the eyes. What did it mean by madarosis? Loss of eyelashes. What did it mean by trichiasis? When the eyelids turned the wrong way around. And finally, just to end off, I want to talk about the posterior blepharitis. This is typically caused by dysfunction of the meibomian glands. It's typically affecting the back lid of the eye, so the inside aspect. And remember, when the meibomian glands are secreting a little oil, the oil is covering the tears we produce. And that oil is basically what's preventing the tears from evaporating immediately. But when the meibomian glands are dysfunctional, there's no oil there, and the tears evaporate immediately, leading to these dry eyes. Now I have another diagram here of blepharitis, and there's two types, anterior and posterior. Posterior is always associated with meibomian gland dysfunction, and anterior is always associated with either ulcerative or squamous. Now, you might think that I'm giving you new words, but this is the same thing. Ulcerative is the same as Staph aureus, and squamous is the same as the seborrheic type. Ulcerative is due to glands of Zeiss and mole affecting the eyelashes, which are at the base of the follicle of the eyelashes. Base of the follicle of the eyelashes. These are also caused by Staph aureus, but remember, all of this stuff is chronic. Your features are going to be, especially for the ulcerative type, bleeding of the ulcer upon removal of the crust. You'll get severe complications, which we've already addressed, and your treatment must be eyelid hygiene, baby shampoo, antibiotics, topical steroids, and artificial, I don't know why I wrote that. Then we have squamous blepharitis, which is to do with dandruff in the eyelashes. So this is a very key symptom. Dandruff in the eyelashes is not something you'll see every day, and when you do, what do you have to think about? You have to think about squamous blepharitis or seborrheic. This one typically does not complicate. And finally, just to end off once again, posterior blepharitis can cause... What is happening in posterior blepharitis? Are we having dysfunction of the glands so much that they reduce their oil secretion? No. You actually have hyper secretion of your lipids. Hypersecretion of your lipids. You have presence of oil/fat globules. You have oily lashes, and you also have a burning sensation in the eyes with posterior blepharitis. And upon rubbing, oil will come out. When did we talk about oil coming out in previous times? We talked about it in internal hordeolum. But here you have yellowish secretions and fat globules literally on the eyelid, okay? So I would really recommend to look at this blocked glands. And for the posterior blepharitis, just imagine these yellowish secretions. These yellowish secretions coming out of this, because that is what you might expect to see in posterior blepharitis, as well as these oil fat globules and inflammation of the meibomian glands so diffusedly. Thank you for watching, and if you enjoyed, please like this video and leave a comment and subscribe. Thanks.